Good morning, everyone. Welcome to InnoHEALTH Conference 2024. I'm Deepshikha, your host for the InnoHEALTH Magazine podcast. And today we have with us Dr. Amit Raj. Thank you for being here, sir.
Hi. Good morning, good afternoon.
It's a pleasure to have you here. If you could please make yourself familiar with our listeners.
Health has been very close to my heart, and Admiral V.K. Singh was a mentor. He's still my mentor. I could still feel him over here. He'll always be there. I mean, the inspiration, he got me in. He said, when I first met him in CII conference in Delhi, where I was just talking about my work. You won't believe, from the first conference where he invited me to be a panel or maybe independent speaker, that time I forgot, that inspired me a lot. I said, so this is how he used to, identify people and kind of get down to their, talent and understand. And with a commanding force, he used to command. I said, I want you here, Amit. There's no questions asked beyond that. I said, sir, obliged. Very well. So that's kind of a personality he was, and he's still around. And I've been reading his books, so he's still a mentor to me. So I always follow his books and few, of his beautiful learnings which he has passed on during my entrepreneurship journey, and as well as into digital health with innovation. So I always keep coming, and I'm thankful to Sachin. And I want to, along with Sachin, probably whatever help I can provide to take this health to heights. So I dream that this should be one of the leading innovation conferences in India. I aim to that in the next few coming years.
Wow. I mean, great input from you, sir. I mean, from over the years in the InnoHEALTH family, we see you've been a really strong part. And
I'm part of this family, and next year probably I would like to contribute even more.
Wow. And so I see you very passionately talking about your learnings from your mentor. So what have you taken forward in all of this time? What do you still keep very close to your heart whenever you are, stepping into different arenas, or when you're imparting those teachings forward? What do you keep very close to yourself from him?
Things I only said, follow your instincts. And if you think that this will definitely, bring in the change, never fall back. Ensure that it brings in, and constantly, learn, constantly, innovate. But the mission which you have dreamt, go for it. That's why, the commanding, the aura of mentor, the commanding aura really has brought in change. So follow your dreams, chase your dreams, no matter what it is, and no matter the world likes it or not. If you like it, if you're happy with it, go for it. End of the day, it's your passion, it's your dream, and if you are convinced that this innovation or this process or whatever thought or work you've been doing is giving you a lot of peace of mind and you're content, go for it.
Rightly so. I mean, you're speaking and it's warming my heart up and driving me as well.
That's how. He put this on me as well. I said, sir, I'm from Gujarat, the remotest part of Gujarat, and then he pulled me. I was like, nah, you have to come for the conference. Like, wow. And he spoke good about the work which we've been doing. And he visited Gujarat. He visited a few of my centers. I have his pictures where we all greeted him. And he spoke, he gave us small, tidbits of leadership in healthcare management as well to my entire team. That's really commendable, and he will always lead.
Wow. Thank you. I mean, we always see, learning from our mentors, and we take their teachings forward, right? And it's so amazing to see you when you have had your own journey so far, and you're still taking him with you where he has imparted some of his experience to you.
Yeah,
and
his learnings, his advices, they are, really apt for the situation, and it's not only for today, tomorrow, it's for the future. And his books on innovation and healthcare management is really, worth reading and taking experience out of the book is the need of hour for the youngsters who are in management.
Wow, and you talked about need of the hour. What do you think is also something which is really essential right now in the current healthcare scenario for people who are maybe trying to follow into your footsteps, or somebody who's setting their foot into the healthcare industry?
I mean, as a startup or as a
maybe a healthcare clinician, an expert, somebody who is looking into policy, somebody something.
Yeah, trends. I mean, deep dive into the gaps. I mean, there are multiple gaps. So deep dive into the gaps and learn from the real-time ground level healthcare workers, namely doctors, paramedics, and probably support team. Learn from them how the gaps are there, and learn from also listen to them on what kind of solution which can be provided, because we all talk about crowdfunding and but we never speak about what others have a solution, who are experts who have been working in that ground. I mean, an example, you go to a receptionist in a hospital, I mean, she's been getting tons of calls. Different type of people come and with different moods they come and talk to them. So how a front office receptionist in a hospital sees the gap, and she herself will say, yes, to solve my problem, I mean I need to have this kind of a solution. So that street smartness, take opinions, take advices, and then formulate your innovation skill, because innovation is over there. The solutions are right over there. And with this one thing I've learned from our professor, Professor Venkat from IAM, who was I mean I was fortunate that he was part of one of the conclaves of InnoHEALTH, where he gave me an insight that industry-driven technology, which is helping other industries like telecommunication, banking. I mean, they are there to provide a solution to certain problems in their sector. You never know that can even come into your sector. So follow or try to amalgamate or learn from industry solutions and try to put that, if that solution can help you.
Thank you.
I mean, I've been doing only this. These are the only two approaches which I have taken. I mean, industry-driven technologies, industry-driven solutions. How those going to come in and bridge my gaps, and understand the gaps, and how take street smart gaps. Learn from the gaps and learn from the solution which the ground level healthcare workers recommend. Though they are not heard of, their voices have never been heard, but at least try to hear from them and then formulate a strategy to solve the gaps. I mean, it can be all stakeholders in the system: patients, relatives, their kids, their healthcare financial consultants, healthcare workers, caregivers at all levels, even doctors. So work as a team. Solutions are there.
Well, you rightly so pointed it out that solutions are right in front of our eyes, and I hope the listeners and people who are aspiring to contribute and build in the healthcare scenario itself take inspiration from what you have imparted to all of us today.
Inspiration is there in the gaps and how passionate you are about. Right. It's all about self-passion. I mean, if you're very keen to, or if you're here only to find a startup and make money and get out of it, it's not going to solve you. You're not going to be really happy or content in whatever you're doing. I mean, find and go for it. The passion is important. No matter you fail, success, that's a different story. But build up that passion. I mean, life is a big journey. I mean, there can be many startup a person can do. But success and failure is a byproduct of your passion, your dream, and how you learn from the system and then go ahead.
Thank you for your input so much, sir. It was a pleasure having you here.
Pleasure was all mine, and I wish next year we do a large, with huge gathering of industry experts and people who are going to learn from the industry experts, because we need is a fantastic audience, a receptive audience who are going to take home a lovely message, and industry experts are there in the entire nation. I mean, so make India proud. I mean, we have so many think tanks, so many doers. This is that we need to collaborate together, ensure that, and then next few years, healthcare is going to be, we are going to be, 5 years or 10 years down the line, with the government's mission and their support, they're going to be an example to how we provide healthcare to the world.
Yes.
We need to set an example. Yes, this is how healthcare is done. Healthcare delivery is done.
Right.
In other countries, population is less, but still there can be some gaps. But here with huge population, how are we going to address to all, cultural differences, language barriers? Yes, but we are doing a fantastic job. I'm telling you, we are doing a fantastic job. So just, next 10, maybe about a decade or two, we're going to be, showcasing the world. This is how it is done.
Wow. And India will be the hub, how the hub of setting examples.
Once that mission is there at the grassroots, I'm sure, it can, filter it up to the,
Of course.
to different people across Indian ecosystem.
Right. A long way to go, but the future doesn't seem too blurry. The ideal healthcare system or what we currently intend to deliver to the population.
We are doing good. We've done fantastic. Change management. Everything you want to change has a lot of resistance initially, but we need to adapt. We need to learn quickly, and and then and the purpose of providing health for all is there. For so this is going to be the dream is going to be really fulfilled, and we will set an example.
Well, of course. Thank you so much, sir.
Thanks.
Thank you so much for your time.
Thanks.
So, thank you.